Here's a patient who is missing 7 and 10, the upper laterals, and this was what it would look like simulated if he had sagittal surgery and the central incisors moved over and then the laterals placed in. Probably would need between 12 and 14 millimeters of space. With the expansion of the arch as well, probably wouldn't need quite that much. This is the situation. He came into the office. If you notice that there was an abscess around tooth number 9, that's actually a recently placed implant. Here's his sagittal look, and you can also see his tongue here. One of the reasons why we're thinking about it is with a constricted palate, his tongue really has no place to go, and we're still in the evaluative stage to see if that's really something that we'll consider. But his tongue really goes out onto his teeth very easily. It also appears to be molded into the palate. It appears that he doesn't have a lot of room for air. He is a mouth breather, but one of the ways we're going to determine if this is really a good situation for him to consider would be to have one of the 3D X-rays, a CBCT, where they'll actually measure the amount of air space in the pharynx, so that we'll be able to see if he's within normal limits. And if he is, then we would go ahead and not consider that, unless of course it was more for an aesthetic reason. Really, to expand the palate at an age of someone who's like 32 years old, you really wouldn't consider that unless there was some sort of airway management type situation. You can see how the Kerper Wilson there is very deep, and the patient, when he talks, you'll see him counting shortly, really doesn't, his tongue kind of flaps out. A little bit later, you'll see the pictures we started taking, and every time we would take a picture, his tongue would be flapping over to the occlusal surfaces of the teeth. So that's one of the things that brought it to mind as far as to evaluate. You can see how the tongue is pushed up into the palatal area there, and it will be, we're still at the preliminary stage. Now there's a couple other things to look at. The implant, there he is talking right there, and so we'll open it up a little bit, and you see how his tongue kind of just pushes over the occlusal surface whenever he's talking, and it also goes up into the palate molding there, and so it's really doesn't appear to have enough room to truly function. One of the dangers of not having enough room is developing obstructive sleep problems as a person gets older, and now would be the time to evaluate it, and with the sagittal surgery, which would open up the palate, would allow him to have a greater amount of space there. When he sticks his tongue out, you can also see how the impression of the teeth are up against the tongue, and which is very typical for somebody who is a bruxer who grinds their teeth at night. When we started taking the photographs for the implant problem, he had recently received an implant. They had done some sort of bone grafting with it, and within 10 days the abscess had started. We had taken the tooth off the crown and or off the implant, cleaned it up, and put him on an antibiotic, and you'll see the before and after of a week towards the end of this. If you don't like seeing blood, then I would stop after you get done seeing the facial shots. So here's the evaluation. We're really trying to go from here where the palate is constricted. We'd like to open it up. It would look something like this. The patient would have to go immediately after surgery like that, but he does have that implant that's in the way, which probably will be replaced. And so you have a larger amount of space initially, and it would look like that. There would probably be a removable partial or something interim. It's possible to do something relatively fixed. Currently, the bone around the implant has that little fenestration area that might possibly be the source of the implant. Once the surgery is done and the bone is filled in between the suture there, we would most likely put an implant in where tooth number 7 is. This is what it would look like, and hopefully it would work out. Here's the initial, the way the patient was brought to us. You can see the infection near the implant there, and here's a little videotape of the initial evaluation. We weren't looking at a constricted palate at this time, but in the process of looking at everything, realized that his tongue was not quite sufficient or didn't have enough space. You can see the pus pocket there. We go ahead and you can see the exudate and the pus that comes out. There's not a huge amount there, but nevertheless, it's fluctuant. Nothing readily is there right at that the beginning of the temporary. That was a lab fabricated temporary. You can start seeing the pus though that's being brought out there. Like I said, after we went ahead, cleaned everything up, actually took the implant out to explore if there was any infection or food particles or what the possible problem could be. The implant itself, there was gum tissue that was covering the implant, and so the implant crown, the temporary crown, wasn't seen the way we would like to see it. We removed a little bit of gum tissue using a laser, and from there we were able to measure. In this case, you can see me measuring the bone around the implant, and everywhere was pretty nicely placed except for right on the buccal there, or the lip side, that there was a depression about 4 millimeters around the implant. Only maybe 2 or 3. This is after we removed the tissues, that you can see what was there. This is a week later. It actually looks pretty good, and I was very hopeful that just taking the implant crown off, getting everything cleaned up, and putting on an antibiotic, that the implant would still be in great shape. Really, as we evaluate it with the rest of the video, you'll see that when we press on the gum tissue, that there is pus coming out. Notice in the tongue as well on those last pictures, how the tongue was just over the occlusal surfaces as we took the photos. That was one of the things that brought to my attention that there might be an airway problem or tongue being constricted too much. See the pus as I press the gum tissue coming out around the side there, and so there's definitely some sort of source there that needs to be taken care of. My guess is that we'll probably end up needing to take the implant out. That would also make it a little bit difficult, or at least something to think about if we were going to do the sagittal surgery. A lot still to look at. We'll have to continue the treatment plan, but that's the goal.